Port Health has come to stay. If Anauka has known about us, Nagav has known about us, OBCF has known about us, Honeywell has known about us, and several others. Of course, many others that didn't know about us before now will get to know. Because our role and our focus is artisanal healthcare service providers in TB services. We want to integrate, Port Health Service want to integrate with them. These roadside sellers, they are important to us because the number of cases they see in a day, you don't see it sitting in your clinic. You don't see it sitting in your program offices. We want to see that the population covered by these people, we will adopt them as part of our population.
Action, Nigeria was saved from the deadly Ebola virus in 2014. In the process, she contracted the virus and died alongside some of her colleagues. When we talk about leadership, what we're seeing from Port Health Services today is the kind of leadership that she displayed, because she faced a lot of pressure from the diplomatic community. She was accused of holding Patrick Sawyer hostage, but she refused and said, I am not letting this person out of this facility, because the person came in and the symptoms were like fever, but when she looked at the person, she was like, no, this is no ordinary fever, and she knew the risk she was facing. But eventually, that was the reason why the Ebola virus was curtailed in Nigeria. And since her death in 2014, GRASA has been in existence to strengthen infection prevention and control across communities, in healthcare facilities, and that led to the work we did with Port Health Services here, with support from Pro Health International in 2021-2022.
I will be representing my head of department, who is the Chief Port Occupational Health Officer, Nigerian Ports Authority. So today we'll be commemorating and celebrating the World TB Day 2026, and the theme, yes, we can end TB at our ports. It reminds us that tuberculosis remains a significant public health concern and an occupational risk within our port environment.
IOM has always been a working partner with the Port Health Authority, and IOM emphasizes the fact that TB is not just a public health disease, it is also a disease linked with mobility. I think our presence here shows that TB is still active, it's still recognized as a preventable killer disease, and transmission is still ongoing.
We hear about port health when they come to the factory to check some documents and all of that, but now it has gone beyond that. We collaborate a lot, we do a lot of work together, we rub minds on multiple issues that concern health. And so I want to thank you, Doctor, for the good work you are doing, and I'm sure that we'll still collaborate more in future and even beyond Honeywell, because right now I'm at Flour Mills of Nigeria. So we are looking to go beyond just Honeywell and go furthermore. Thank you so much.
I'm really happy anybody was invited, and we'll support you people, and if you need anything, can put us in our office. Thank you very much.
It's a very splendid job that Port Health Service are trying to introduce, and having a desk in this very port, because it's really a point of contact, and it's a financial environment. People come to transact in their millions. So I think if we can have this cluster, it will reduce the 11% that we are talking about,
which is the World TB Day. Port Health has they have been visiting us, they have been part of it, and we have been part of every of the activities happening in that Port Health is organizing. We have been participating, we have been a partner, and they have been so helpful. At least so many things, even the work they did in this food handlers issue, at least the team helped to sanitize so many things in the port.
I was briefed this morning about this, but one thing I know is this collaboration, we are highly interested. My chairman, Ms. Boa, in the time of COVID-19, I know what he did. So the moment I conveyed this to them, we will relate to him and he will do more. Thank you.
The president of NAGAV sends his greetings to you all. He would have been here personally, but he's unavoidably absent, and that's why he asked me to sit in for him. And the one thing that really came to mind during your presentation was that when you said from 1977 up until now, that this initiative, that you started piloting it like 3 years ago. One question that readily comes to mind is what has happened between then and now? It means those other people didn't see the need just like you did. So we thank God for this vision, and then we pray that God will give you the grace. Coming from the freight forwarders perspective, we also want to partner with you and see how freight forwarders can benefit immensely from this program, because if you talk about freight forwarders and all of that, all I know about Port Health before now is once you're traveling, this yellow card, that yellow card that you get, that's strictly when you're traveling. But beyond that, this multitude that you see that troop in and out of the port on daily basis, what plans do you have for them?
So in the month of April, first week, we have one. We have done some at the national with a repeated visit. So every month we commemorate, and with the creation of these decks now, Osha will be completely part of the person who will be handling the TV component.
Just like we already mentioned, we've been in Tincan for a very long period, but we have not been hearing about corporate services. Nobody is aware of it and its activities. So it shows that there's a great work to be done. And now you have started this sensitization. Like you rightly said, the management of our association will want to partner with you so that even before you think of going to the rural villages, the main village where you are in Tincan here, that constitutes a larger population of those who are coming from different locations, need to benefit from this, because the traffic volume here is very high.
Today, as we commemorate the World Tuberculosis Day, we are not merely observing a date in the calendar, we are confronting reality that continues to affect millions of lives, including countless families here in Nigeria. Let us rise with courage. Let us act with urgency. Let us build a Nigeria where no one dies from a preventable and curable disease.